Recognizing the House Leader of the Third Party.
Thank you, Honourable Speaker. I'm pleased to rise to speak to Bill 29, the Child, Family and Community Services Amendment Act. I want to start by acknowledging the difficulties that arise when speaking about child welfare in Canada, particularly the complexities that surround the Ministry of Children and Family Development in BC. The provincial and federal governments of Canada have a long and fraught history with systems of so-called child welfare. Anytime we discuss proposed reforms, we also must grapple with this history. These systematic processes of removal have undoubtedly influenced the creation of the modern child welfare system. The Indian residential school system was a catalyst for fragmented families and communities. The forced removal of Indigenous children from their parents and communities was an act of violence against the First People of these lands, perpetrated by colonial governments and churches. These institutions perpetrated immense harm that communities across BC are still grappling with. The 60s Scoop, the name given to the series of government policies that forcibly removed Indigenous children from their families to non-Indigenous foster homes, was devastating. Between 1951 to the mid-80s, over 20,000 First Nations, Inuit, and Métis children were taken from their homes and placed in mostly white households. The narrative told to these foster and adoptive families were that they could, quote, do good, unquote, by adopting an Indigenous child. Programs like AIM, Adopt an Indian, started in the 1960s. Ads were placed in newspapers and department stores with photos and captions stating, "Today's child, brown-skinned babies for adoption, contact AIM." And even with the last decade, we've seen similar dehumanizing advertisements. In 2017, a CBC News article described advertisements published by MCFD. Children up for adoption through the ministry were searchable by age, gender, race. The article identified the concerning similarity between these advertisements and those published in newspapers during the 60s Scoop. Indigenous communities shared their concern with MCFD, and thankfully the searchable profiles were removed and the process changed. From residential schools and the 60s Scoop to the modern child welfare system, Indigenous children in BC have been removed from their culture, language, families, and communities. This fracturing of families and culture has proven devastating, and Indigenous children are still disproportionately represented in the child welfare system. In 2021, over half of the children in foster care were Indigenous, despite only comprising 7% of the child population in Canada. There are more Indigenous children in government care now than there were at the height of the 60s Scoop. When we talk about any proposed reforms to MCFD, we must acknowledge the history of how we got here, how we got to this day. We're glad to see a shift happening with a trending decrease of Indigenous children in government care in BC in recent years. We've seen instrumental legislative change like the Declaration of the Rights of Indigenous People Act, an act respecting First Nations, Inuit and Métis children, youth and families at the federal level, and the continuing shift towards recognizing Indigenous jurisdiction in child welfare. I just want to pause to emphasize that it is acts like the Declaration on the Rights of Indigenous Peoples Act that are creating the foundation for the important work of undoing over 150 years of horrific treatment of Indigenous children in this province and in Canada. The representative for Children and Youth continues to shine a light on the Ministry of Children and Family Development, highlighting the serious need for comprehensive reforms across the entire system. The well-being, safety, and health of children are core priorities of MCFD. We're glad to see this government taking this responsibility seriously, as demonstrated through these proposed amendments we're discussing today. The amendments proposed in Bill 29 seek to clearly outline legal authority for safety plans. Safety plans are a voluntary agreement between parents and MCFD that are entered into with the intention of creating conditions for keeping a child safe. These plans are designed as a short-term transitory tool and are seen as less disruptive compared to other measures, such as removal from the home. And I can say from my past experience of representing First Nations for 25 years that removal from the home is an incredibly disturbing approach. And so these types of agreements done properly with clarity are an important alternative. Parents and guardians must agree to all terms and conditions in safety plans, which may include ensuring someone who poses a threat to child safety is not in contact with the child, or moving the child to a safe location, such as a grandparent when risk is present. Safety plans have already been in use for decades in policy, but there are challenges. MCFD and advocates have seen problems with consistency. Safety plans have all too often been seen as coercive and unnecessarily restrictive. Some parents have been presented with a safety plan as a threat. Do this, or we're taking your child. The representative of Children and Youth has written several reports outlining the gaps and failures of the Ministry of Children and Family Development. Most notably, the Don't Look Away report released in 2024 highlighted numerous systemic failures in the child welfare system in BC. We understand that the recommendations from this report played an important role in influencing this bill. A key message in Don't Look Away emphasizes that confusion and ambiguity can give way to tragic circumstances. The RCY expressed that more legislative clarity would be essential to decreasing ambiguity and improving outcomes for all persons involved, especially children. These proposed amendments to the Child, Family and Community Service Act create a new section on safety planning. Bill 29 seeks to clearly outline the legal authority of safety plan agreements, who is required to be involved, how decisions can be made, when safety plans can be withdrawn, and notification procedures. It emphasizes that parents and guardians can seek legal advice at any time, that these procedural safeguards are extremely important. The Ministry has expressed that safety plans must be clear, fair, and voluntary. This type of legislation, this bill, is exactly what we're looking for, a step forward to providing that clarity, to remove ambiguity, to ensure that safety plans can be and will be effective. We are glad to see these proposed amendments. As described by the RCY, legislative clarity will be essential to improving the systems of care within MCFD. I'm grateful to see this important step forward, and I also must emphasize that we have a long way to go. I'd like to highlight some of the recommendations from the RCY report, Don't Look Away. How one body's story has the power to shift a system of care for children and youth. Don't Look Away identified the systemic failures and gaps of child welfare in BC. The entire system of social services in BC is siloed, and low-income and marginalized families are often the ones to bear the brunt of systems that fail to communicate with each other. The RCY highlights some systemic gaps, including inequities and lack of oversight in family caregiving arrangements, significant weaknesses in interagency collaboration and communication, inadequate family supports and early prevention services, blurred accountability as jurisdiction shifts to First Nations and Indigenous governing bodies, unaddressed violence, often intergenerational in children's lives. Child welfare sector advocates have been sounding the alarm for years. Heavy workloads, difficulties with staff recruitment and retention, increasing complexity of child protection work, and chronic shortage of registered social workers have together created unsustainable conditions in the Ministry of Children and Family Development. The RCY's report, No Time to Wait, identified a crisis in child welfare workforce. Here are some statistics that I think we should all remind ourselves of and be aware of. 80% of social workers say they're unable to properly do their jobs because their caseloads are too high. 77% of social workers lack timely access to necessary family and community supports to help the children and families they're working with. 90% of social workers report having very high stress levels. There is consistently low compliance with a range of provincial and policy practice standards due to those excessive workloads. And previous MCFD analysis of the workforce found that meeting just 85% compliance with provincial standards would require hiring several hundred more social workers. Honourable Speaker, these proposed changes outlined in Bill 29 reflect a necessary step to improving MCFD service delivery. However, we must also emphasize the need to continue improving accountability and oversight of child welfare in the province, including other key steps like the regulation of social workers. We also hope clearly and fervently to see greater incorporation of cultural safety planning in collaboration with First Nations. The maintenance and incorporation of culture into every aspect of this work with First Nations and Indigenous people is hugely important. In times of austerity at every level of government, we must also ensure that enough resources are being allocated to support these necessary changes. When the provincial deficit rises and budgets get tightened, often what gets cut first are social programs. Programs and services which are essential to creating certainty and stability for families and children. This is an area that needs more, not less, resources. I'd like to applaud this government for taking these steps to improve legislative clarity for safety plans, showing their commitment to implementing the recommendations from the representative children and youth. As I've highlighted today, the history of child welfare in this province is fraught and complex. I hope we can make this bill another step in the continuing work to address historical injustices, present-day harms, and work towards improving accountability and oversight. I hope we can build a system we can all be proud of. Thank you.